Hey everybody, I'm Cliff. This is Life with MS, and today I want to talk to you about something therapeutic lag or the possible fountain of youth. I don't know. That's kind of what I'm calling it. We'll talk about that in a second. About 8 days ago, Dr. Aaron Boster made this really great video about therapeutic lag. I'm going to link it below. It's a great professionals' advice and perspective on therapeutic lag when it comes to multiple sclerosis and DMTs. But in this particular episode here, we're going to talk about a patient's perspective. Okay, so let's back up to 2018 when I start getting diagnosed with multiple sclerosis, and early 2019 when I start taking DMTs for multiple sclerosis. What were my expectations being new to the disease, if you will? Well, okay, I've grown up in the Western world, and I think here we kind of have the expectation that if we take a drug for something, it is going to fix something. That's not how DMTs work. And I didn't really understand that in the beginning. I thought if I took a disease modifying therapy, it would modify the disease and my symptoms would go away. But in reality, it works a little bit more like a fountain of youth in that it locks you in that position you're in right there and doesn't allow that disease to progress. And I'm not sure if I didn't hear that as a patient who was just totally overwhelmed or if that was not conveyed to me. I'm pretty sure it was. But I do remember in the first 6 months of my journey on my DMT, calling my neurologist multiple times and saying, Doc, this is not working. Like, I'm still progressing. I would go in and get an MRI, and I would be in the middle of a relapse, and I would have new brain flare activity and new spinal lesions. And I would say, why are we doing this? Why are we doing this crazy drug if all it's doing is make me feel like crap? And I do remember him at one point saying, we're not treating for the now, we're treating for tomorrow. And I never really understood that because I was just too far in the trenches. But basically, the idea was that, like, I'm taking care of the crap today so I don't have to deal with the disaster of tomorrow. And I think I talked a little bit about this in my MavenClad episode last week about my decision to start MavenClad after my failure on Ocrevus and my failure on Kesimpta. But there's this thing in there that I've learned with these particular class of drugs, and there is therapeutic lag. I think when we initially start them, we think we're just going to be fine and things are going to resolve. But they don't. That's not what this class of drug is about. It is about stopping the progression or slowing the progression and not reversing the issues at hand. Now, we're working on drugs for that, but as patients, I think we're just preconditioned to think that we're gonna walk out of there, we're gonna take drugs, and we're gonna be fine, and that is just not how this particular thing works. And so that was always a shock to me, and I always had a tough time figuring out what to expect from the drugs. And I think therapeutic lag, even though it's a very medical termy kind of phrase, is a really great way of saying it. And the metaphors and examples that Dr. Boster gives in his episode are really good. And I'm just speaking from my own experience. Of course, I'm not a doctor. I'm just a bald dude on YouTube with MS and just talking about what I experienced with these drugs. And that is that, like, there is a lag and things didn't really start feeling like they weren't progressing until probably 8 to 10 months into my first DMT, which was Ocrevus. And that's when the relapses really started decreasing. But there was a lot of change in that time. I was learning how to manage the disease, unfortunately, through experience, because I think it's different for everybody, but it was modifying my diet, modifying my lifestyle, avoiding bad habits, getting good sleeps, exercising, all that stuff regularly. Like, these were things I just couldn't do intermittently. It took a lot of effort to regulate this stuff and make it work. And that's when things started getting better. And when I say better, I mean less disease activity in terms of relapses. Now, there are the symptoms and the exacerbations that I have that just never go away. Like, I'm locked in that spot right now. So if I start taking my MavenClad next week and it wipes out my immune system, how long will that therapeutic lag be? I don't know, but I still don't have any CD20 cells and I don't have any CD19 cells left over from my Kesimpta, which I quit almost 10 months ago. I've had no actual noticeable progression in terms of relapses in probably the last 3 or 4 years since starting the DMTs, because even though I've had to quit them, there's a lot of carryover. Like, my CD20 and CD19 cells still haven't rebuilt themselves. And that's what those target. Now, MavenClad's a different game altogether. Where will there be a therapeutic lag in it? I don't know. We're just going to have to wait and see. I'll probably start that next week. And the therapeutic dosing requires a year of taking the drug. You take it for 2 weeks and then you stop it. And then you take it again for another 2 weeks, a calendar year later. But my expectation is I'm stuck in this spot. Like I will be dealing with the symptoms I have now and hopefully not continual progression of the disease. I may have more symptoms, but they won't be related to a relapse. So now I'm preparing myself for possible therapeutic lag. What if I relapse in that time? It could happen, but that doesn't mean the drugs aren't working. They just aren't working yet. So I just wanted to cover that today because I thought what Boster said is really important, especially if you're watching this and you're not subscribed yet, make sure you do that. But also, I think what Boster says is really important for people that are newly diagnosed that don't understand this journey yet, because it can be really, really frustrating to be going through all this stuff, all these blood tests and all these neurological tests and seeing all these doctors and not seeing results. And that could be the result of therapeutic lag. You're not seeing results yet because things have not kicked into full gear and it's going to take some time. So I wanted to share that because I just wanted to comment on his video. I think it's great, especially if you're newly diagnosed. In the meantime, I'm going to continue to update you on my MavenClad journey. There's a lot happening behind the scenes right now. Probably a new video coming out about that in the next couple of days. My name is Cliff. This is Life with MS. And until next time, I appreciate you all. The MS community rocks. I'll talk to you soon. I'm out.